Thank you, Dr. Maumoon, for giving us some time just to discuss mental health and ways of supporting people who are facing mental health issues. So, so as a professional, what would you suggest is the best course of action for someone who is in need of urgent mental health support?
Okay. So the first thing is we have to decide what is urgent psychiatric, condition that requires help. So it doesn't depend on which particular diagnosis you're talking about, but it's more about, is there an immediate danger to the patient's life or an immediate danger to the people around him in the community? Then it becomes an emergency. So at the highest, we have people with suicidal intent. Okay? So if you have thoughts like, I wish I disappeared, I wish I didn't exist, I wish a vehicle would hit me, those are passive death wishes. Like, I'm not actively going to do anything, but I'm okay if I'm not here, right? But then if you have thoughts like, what, I'm going to do this, I'm going to do that to end it all, that becomes active ideation. But if you make a plan, if you have the intention of carrying it out on a certain date, in a certain way, that's active suicidal intention. So if someone has active suicidal intention, or if someone has a suicide attempt which did not work and that person is still alive, that's a psychiatric emergency. That is the time when you have to rush him to the hospital, okay? Or if someone has attempted self-harm and it has managed to harm their body, like somebody might take a bunch of medication. Now, we don't know what's going to happen or what type of medication it is, but we have to pump their stomach, make sure they're not affected, make sure their liver is okay. So you have to rush him to the hospital. If they self-harm by cutting themselves, we have to make sure that no veins or tendons or anything is damaged. Is there suturing needed? Again, we have to rush to the hospital. If someone is actively violent or out of control, like if someone is undergoing substance withdrawal, then we have to take them to the hospital. If someone is in a state of psychosis where they're not able to tell the difference between what is real and what's not, if they have delusions of persecution where they believe everyone is out to get them, or they have command hallucinations, these happen when they're out of touch with reality, in a state of psychosis, then you have to bring them to the ER. If you are in a stage of delirium, or you are agitated enough to harm yourself or the people around you, then you have to bring them to the ER. So what do you do? So if you're in that vicinity, you have to make sure you don't leave the patient there alone. You have to be there. You can call someone, a family member, a teacher, a policeman, anyone to assist you. You can make sure that you immediately take them to the hospital, not wait until, we'll wait till the morning. It's okay, you can rush them to the hospital. And you can talk to them in a calm manner, but don't expose yourself in a situation where you're in danger. But you can talk to them, you can offer them help, and you can take them to the hospital immediately. So it's better to call for help and then try to get them the care they need immediately rather than waiting.
So in the case of perhaps somebody who is on their own, if they want to reach out for help at the last, like just before they actually harm themselves, in that case, what are the resources available to them?
So there are resources available. There is the National 24-hour mental health service hotline, and those are manned by people with counseling certificates. They have already graduated from counselor post, and they can direct you on which help you need, or they can immediately start counseling as well. So the number is 1677, and once you call them, they will direct you to what type of help you need, or they can start counseling right there itself. Some people need just a voice to listen to, or just to get distracted, or just someone to talk to, someone to reach out to. Some people might need social services to come and check up on them, Some people might need the police victim support unit to come and check up on them. Someone might actually have to go to the ER. So whatever services are required, you can call the helpline. If you are alone and you have thoughts of harming yourself that you are having difficulty controlling, you can do anything to divert your attention elsewhere, like, just holding some ice cubes in your hand, pacing up and down, calling a close friend. If you really have the urge to cut, you can just use it in another way. You can cut some paper, you can, draw some lines on your wrist. There are different ways you can distract yourself. There are different ways you can ground yourself just to delay that urge. But if you keep having these thoughts, of course, you have to seek help. Yeah.
Do you think that there's been concerns recently that self-harm and risky behavior, especially among youth, is increasing in over recent years? Do you think that's the case, or is it that more people are seeking treatment now, more people are openly talking about it now? What's your opinion?
So, if you generalize it to overall mental health concerns and mental health illnesses, you can say more people are aware of it. That is part of it. More people are aware that what they're going through is a mental situation. For example, if people go and raise awareness in the islands, for example, I had one person who said, they were talking about thyroid issues, just raising awareness of metabolic thyroid issues, and then listening to that, she realized that the anxiety that she has is from her thyroid condition. So she learned something and she went to get help. So when people are more aware that what they're going through are some kind of symptoms of anxiety or depression or OCD, then more people seek help. So that's one factor. And the other factor is people are more isolated now and there's less community, so people are trying to fix everything on their own. So there is really little, like there used to be we used to know our neighbors, we used to know our friends, and there used to be people we knew right next to us for generations. But now someone is working in the resort, someone else is in the island, someone else is studying in Mali. So that extended family unit is no longer there. There's more isolation. Also, there's more screen time, and you're basically looking at TikTok and Instagram and comparing yourself to all the wonderful times they're having, all the wonderful looks they're having, and comparing yourselves to them and then feeling bad about yourself. So there's a lot of people who are not really getting the help they need and trying to struggle on their own. So that's another part of it as well. So one is the community, the other one is being more aware of it. But overall, I would say we do have more mental health issues and complaints now than before.
And as a society, what can we do to improve the situation? What can we do?
So as a society, when you have to look at the people like Malaysia, Thailand, Singapore, neighboring countries, and most of the budget is now going towards social health or community health. There are very few mental health professionals. There are few psychiatrists, few psychologists. It takes 12 years to make one psychiatrist, 6 or 7 years to get a psychologist, and community and counselors and all these professionals are very less. So the whole community, if they're waiting in queue to see these people, it's not going to be very effective. So those professionals should be only for severe cases, complicated cases that require a lot of attention. So mostly what those countries are going for is community health, where the community is taught to be aware of mental health conditions before it becomes severe. like someone is going to school regularly and suddenly the grades start stopping, they're not attending regularly, they're isolating, you feel like something is off. The teacher and the student should catch that immediately and start intervention at that stage before it becomes worse. If someone is going to work and suddenly starts, getting irritable, they're taking a lot of sick leaves, they look like something is wrong with them. Then their supervisors, their co-workers, everyone should catch that at that time and, get them the help they need at that time before it becomes severe. And then at the community level, if there are ways that people with chronic illnesses, with chronic mental health illnesses, whether they can participate in the community. Like I have some patients, they can't hold a full-time job, but if we can facilitate some ways for them to go to work regularly for a job that we just have to do for 3 hours or 4 hours or work every 3 days per week, it helps them to go out in the community and interact and be with people and be part of the community. And if there are ways that we can check whether they're taking regular medication, they're eating well, they're sleeping well, they're exercising, then there's a lot, it's more effective than just trying to, have more numbers at the top. So I would say as a community, we should focus mostly on prevention and making sure the people with chronic conditions get the help they need. And then at the same time, there's a lot of stigma still regarding mental health. So people are, they don't want to be known as people with mental conditions. You can call them whatever else, it's fine. They don't want others to see them go into the mental department or someone who's taking mental, medications for that. So that term is still highly stigmatized to the point that, some people in the islands, they don't want the local doctors to know, or the translators or the staff of the hospital to know. They go to another island to get the treatment they need. Or psychiatrist has to visit them in a way that the rest of the people don't know that they're getting the treatment they need. And there are times when even diagnoses are used to bully people. Like I have come across people where the children in the school are calling them OT because they go for occupational therapy. Or autistic is again a term used for to bully. Okay, so there's a lot of bullying involved. There's a lot of negative stigma, but we have to see like what happened in the past, like things like leprosy, HIV, TB. Used to be very ostracized. Those people used to be taken out of society. They used to feel embarrassed to talk about their conditions. But health workers and people in the community, people known in the community and trusted in the community, they did a lot of good work, and they made these people get the treatment they needed. And now people are no longer scared to talk about these conditions. So if it can be done for those conditions, it can be done for mental health as well. And we can openly talk about it and get the help we need. So it's not impossible, but there is a lot of work to be done.
So, Doctor, I wanted to ask you about self-harm. What are the factors that usually create the risk of self-harm?
So mostly it leads back to the childhood. So when we grow up, when we are at that vulnerable age, what we experience in that age and what environment that we grow up in is of very big importance. And you are supposed to get the emotional support you require from both your parents and the people around you. So if you don't get emotional support, if there is a divorce and one of the parents absent in your life, or you witness a lot of arguments between your parents, you witness abuse or trauma, or even it's not only about parents. If you experience bullying in school at an early age, or if you have a traumatic experience from a family member or from someone outside, in your formative years, these people kind of struggle in three major areas. So one is they struggle to have healthy relationships with friends and family and their loved ones. They always feel like they're about to leave, so they do a lot of drastic things to make sure they don't leave. Or sometimes they sabotage perfectly healthy relationships because they feel like they might leave. So there's a lot of pushing and pulling. And secondly, they do a lot of impulsive actions without thinking of the consequences, like, overdose, self-harming, cutting, driving vehicles fast, substance use, binge eating, wasting money, jumping into relationships. And thirdly, they are not able to regulate their emotions. So when they're irritable, they become very irritable. When they're sad, they don't know what to do. And they live life in this stage of hyper-vigilance, hyper-arousal, where they notice everything and they're hurt by everything. So we should try as much as possible to be present in the lives of kids when they're growing up in their formative years. Even if the parents are divorced, they should spend quality time with the kids. Show them how healthy relationships are. Show them how to deal with your emotions. Show them how to pause before you react, at least how to take a deep breath, how to count and then react. And show them healthy ways of coping so that when you grow up, you have healthy examples of how emotions should be expressed, what relationships are, what healthy, things that I can do to keep myself occupied, like sports and, activities that you do to calm yourself down. So if you grow up in that supportive environment, that makes a very big difference.
Also, what can families do to support people living with mental health
So
struggles?
it's a very narrow line to walk, because sometimes a child might say, okay, you know what, I'm going to self harm, I'm going to do something if you force me to go to school. So a lot of kids are now refusing to go to school, and they're staying and watching TV, playing video games, just doom scrolling and bed rotting. And that is where the parent has to kind of not force the child to do things or scream at them, but you have to always divert the kid in a way that, you know what, you should get up, you should take a shower, you should try to go to school on time. And if you are, in such a bad way that you're not able to tolerate going to school, at least we try to make sure they go to school at least for 1 hour, so that you gradually expose yourself to the school environment until you become well enough to sit for the entire school, all the classes. So it's not that I have mental issue, I can't do this, I can't work, I can't do that, but trying as much as possible to make sure that the person is functioning well. If there's someone who's diagnosed with depression, anxiety, you as a family member should make sure that, hey, is this person eating well? Is this person sleeping enough? Is this person getting enough exercise? Or make sure that they are not isolating. Make sure that they go out of their house. Go for a walk. Go for some exercise, and make sure that they have enough friends, or they have someone that they trust that they can share with, so that they don't bottle up all the emotion. So someone that you can share and talk with, and regularly. Someone to make sure that you're sleeping enough, eating well, and someone to make sure you're exercising. And lastly, that state of hyper vigilance, it should be brought back down to a state of calmness. So making sure that you're not just doom scrolling, but creating something with your hands, like doodling, journaling, drawing, making cake, cooking, having a pet, something you can do with your hands that's creative. Those are very calming activities. So 3 of those things, if you can do, very likely that you'll be resilient enough to deal with your mental health issues. And as someone who's living with someone dealing with mental health struggles, if you can make sure that these people do these things, if you can make sure that they go to the hospital and get the help they need, because in most other departments the patient will rush to the hospital, but in our case they struggle to go. So if you can make sure that they go and get the help they need, that is how you help. And a lot of times the attitude from the family and friends are like, it's not so bad, so and so had the same thing but they managed to deal with it. So the whole point is not to even talk, but to be there, your presence, give your presence, and listen in a non-judgmental way and let the other person talk. And then giving a message like, I'm here, I can help you, I can make sure you get the help you need. There's no need to say it's not so bad, because we don't know what that person's level of stressor is. So non-judgmentally listening and steering them towards the help they need, that is the best way we can go about it.